Hello and welcome to Joyful Living Podcast. I'm your host, Kimberly Dixon. Thank you for tuning in. And a very special thank you to our sponsor, Authors and Arts Studio, owned by Tara Henry at 3303 Suite 103 Rock Quarry Road. The purpose of the Joyful Living Podcast is to share inspiring stories, but also to arm the community with information that they can use in their everyday life. Today, our special guest is Demetrius Bethea. I had the pleasure of meeting Demetrius a few weeks ago at the We Are Connected quarterly networking event and immediately knew that I wanted him to be on the podcast to share with you all tonight. Welcome our special guest, Demetrius Bethea. Demetrius, welcome.
Thank you so much for having me.
I'm so glad to have you here tonight. Tell everybody about yourself.
So I am 26. I recently moved here less than 2 years ago from Arizona. I moved down here to be closer to family. So I had this vision in my mind to start a business and to just be closer to family because Arizona is so far away.
Right.
So since being here, it's been amazing. It's been life changing. I've met so many amazing people like you, and it's been a life changing experience.
But this is the most important question: have you adapted to the spastic North Carolina weather yet?
So I have. So let me tell you. So compared to being in Arizona when it's 123 degrees, and then I was in Buffalo, New York before that when it's negative 2 degrees.
Nothing. We don't have anything on Buffalo, New York, or Arizona. So you mentioned that you are a business owner, and I know from speaking with you previously, the name of your business is the Royal Umbrella. Tell us about that.
So the Royal Umbrella is a staffing company, and we focus on the permanent placement of medical and technology professionals. So the focus is trying to get people back to work and helping businesses to lower their onboarding costs.
Okay, so does it operate like a temporary agency and you just bring them in permanently, but kind of just where you fit people to the needs of their employers?
Exactly, yeah. So we basically, so our main, our clients are going to be like the businesses, and they'll reach out to us, say, hey, we have this position open, we're having difficulty filling it, and then people that are within our database, we'll place them if they meet, the client's needs.
Oh, okay. So where did you get the idea for this service?
So it came from God, because this was not my initial thought process at all. I knew I wanted to start a business, and the name came to me in a motel in Louisiana on the way to North Carolina.
Oh my goodness!
So it was not something where it was like this elaborate plan that I hear a lot of people they have, and they're like, it just, I had this and I put the numbers, and it wasn't that. I prayed on it, and then piece by piece it came together and it transformed into what it is today.
That's amazing. But it's so awesome that when we listen to the directions that we're getting from God, because he's often speaking to us, but we don't follow those. But when we follow the blueprint that he's given us, it can amazing things happen.
Yes, definitely.
Because you're following out your purpose and not just living day to day, but doing the things that he created you for.
Yes.
So I know when we met initially, we spoke about medical advocacy. Tell us why you're so passionate about medical advocacy.
So growing up, one of the biggest cheerleaders still to this day is my mom. And my mom has had sickle cell, her entire life. Growing up with her and watching her battle this disease, and just seeing what it has done to her and how she's continued to just keep fighting and be an advocate for herself. As she gets older, it has dawned on me that there wasn't a lot of people outside of herself in my family that were really speaking up for her when it came to doctors, when it came to going to different medical appointments. And since she has a background in medicine, it helped her a lot. But I think of the person who they don't have that. They don't have a background in medicine, and maybe they don't have a family.
That's true.
And if they don't have those things, who's standing up for them? Because there's many times when she's been turned away, or someone has told her basically that they think that people with chronic illnesses a lot of times are drug seeking when they're not.
Right.
Oftentimes, they're in pain.
So how's your mom doing now?
So my mom, she's a soldier. Like, she just keeps fighting. So she's doing well. She was recently in the hospital, and it's just like her to keep fighting and bounce back every time. So she's working full time as a nurse practitioner, and she sick or in pain or not, she keeps praying and keeps pushing and continues on another day.
Okay, well, that's awesome. I'm glad to hear that. So we wanted to talk about medical advocacy just a little bit on tonight, because so often we go to the physicians and we see them as the authority on anything medical related. But as a patient, it is our responsibility to be able to speak up for ourselves and be able to make well-informed decisions. But if we don't know that we can actually say no to a physician, we will take their word for gospel and just follow along. And before we know it, we're 70 years old and we have a nightstand full of pills. But if the doctor had just told us some different options, then that may not have been the outcome. So we really want to impress upon people that you should, but you have a right to ask questions when you're in the doctor's office. You have a right to say, no, I don't think that's a treatment option for me. What else is available? Or, whatever it may be. But we have to learn as a people, as a human race, that when we go into a doctor's office, that we have rights and we have options that sometimes, depending on the physician, they may be great and they may give you all the options, and they may just be doing a paper meal or a meal, because the medical industry has changed so much in the years that, just in the years that I've been going to the doctor, because there was a time when we used to have a personal relationship with your family physician. They knew who you were on site. But now when you go into a practitioner's office, you may see any number of different people, and the next time you're there, you see someone else. So they don't know you personally. They're only glancing at your chart before they come in, and they don't know you, just intimately, where things can have play a role in their outcomes, because all of that stuff matters. But it's not a healing industry; it's a treating industry. So that's one of the things that we have to really recognize, that is when you go to a physician's office, you are there to be treated. 9 times out of 10, they're not going to heal anything. And that's not saying anything about physicians. I have some great relationships with them and I go to them, but we have to understand that they are not gods, and that we have options, and that we have a choice. Did you have anything? What would you like to say about that?
I think that you hit the nail on the head. I think that's very important. A lot of times we're not necessarily informed that we can, question that. I think just going back to even just previous years, hearing my family, and they would talk about, like my great grandmother, my grandmothers, and it's thought that whatever these physicians say, that's the only answer that they can get, and that if you question it, that basically there's nowhere else for you to go.
Right.
As well as a lot of the treatment methods have proven, over time, that people are becoming addicted to the medicines that they're being prescribed, where now we have this opioid crisis and things of that nature, where now I think where people are not only needing to have advocates inside of their hospital, but also be advocates and push for themselves to have a healthier lifestyle through just the holistic methods and looking at preventative care and things that they can do outside of the hospital. So that way when they go there, then that's more so of a last resort as opposed to it being the only answer.
That is so very true. Guys, stay tuned for just a moment while we have a message from our sponsor, Authors and Arts Studio, with owner Tara Henry.
Hello, I'm Tara Henry, the owner and artist of Authors and Arts Studio. I really would invite you to come learn more about the studio at www.authorsandart.com/contact to learn more information. Here we focus on creative wellness and community building. You can find us at 3303 Rock Quarry Road, Suite 103, Raleigh, North Carolina, 27610. Please learn more. It really is about you.
Demetrius, as someone who works with the medical community, how can we do a better job of advocating for ourselves?
I would say being informed. These days, there's so much information that's out there that you can research and look into for yourself. So just having that information on what is specifically needed for yourself, because everyone is, so different. And sometimes the treatment that you may receive may be more so generalized to that particular condition, where your condition may be different than the next person's. So I would say educating yourself on what things work best for you. So when you go into these places and you're meeting with these individuals, a lot of times they have the best intentions for you. You know, a lot of the providers that I meet with and that I've connected to, these are amazing individuals that they have a heart for just really helping people. But there's still limitations, as you said, because they're not God. They're still human. So I would say learning what things work best for yourself.
And just to tell a quick story, I remember years ago I was having an issue with some numbness and tingling in my feet, and I went to see my physician, but his schedule was full that day, so I saw someone else in the practice, and I really wasn't pleased with the treatment because it was so rushed, and she just immediately wrote me out a prescription. And I told her, I don't want a prescription. I want to know what's wrong with me. But it was funny because it was my physician who had actually told me, don't just take medicine from people. He's like, when there's something hurting you, you need to get to the root of the cause. And a lot of times, if you have a physician that just gives you medication, ask some questions. And if they get upset with you asking questions, they're not the physician for you. But most physicians, they're going to be open to you asking questions. And this is another thing that I've learned, that when you go in and you're informed and you ask questions and they realize that you know about you and your health, you'll get better treatment. Yeah. Because they're like, she knows what she's doing, and she knows, that she's going to research the things that I tell her. And that's not to go in there, don't be argumentative and flipping over tables and things of that nature. But there's a way where you can get the absolute best treatment and advocate for yourself and ask questions and have a great relationship with your provider, because they're going to just give you the absolute best because they know that you're going to advocate for yourself. You're going to speak up.
It's so true. I mean, and one of the things, that I've witnessed firsthand just through my mom is, there's a medication in particular that didn't work well for her for pain. It just didn't. And however, that particular drug is a go-to drug for sickle cell patients. And she needed something different. And immediately when she was in the hospital, they said, well, we're going to give you this. She said, that doesn't work for me because of X, Y, and Z. This is the track record of this. You can contact, my physician if you need to verify it. This is what works best for me, and you can contact them and verify that as well. Yeah. And just being able to say that and speak to those things, I think is so important, because if she would have just accepted that, she would have been laying there in pain, and in their eyes, she should have been fine, because they would have think that it would work. Yeah,
that's so true. It's like, and you go through hours of them to see if it's going to work, when if you know those things about yourself, like I know I can't take Percocet. It will make me violently ill. And I have had an outpatient, because most of you guys know I've had 13 orthopedic surgeries. It's been so many, y'all, I forgot. It's 11 or 13. It's a lot. I've had quite a few orthopedic surgeries, and I know that I can't take Percocet. So when my sister was taking me for an outpatient procedure, getting a knee scope, and I gave her a note, please tell a physician when the surgery is over, don't prescribe me Percocet. And she remembered just as she was leaving the office and looked down at the prescription, and they had given me Percocet because that's the go-to. But she's like, oh no, she can't take that. So he quickly, and it was a surgeon I'd had multiple times, and he was like, that's right, Miss Dixon knows what she can and can't take. But because I knew, and I was able to let my family know, I was able, when I got home, I had the medication that I needed, instead of looking at him like, I can't take that.
So maybe too is not only being an advocate, but creating advocates, like with your family, and letting people know, because sometimes it's become like taboo inside some families to even discuss medical issues and discuss things that are going on with you.
Let's talk about that for a minute, because getting my parents to talk about medical things was like pulling teeth. But because my sister and I have pressed the issue and we just kept asking questions, they're a little bit open to it now. So what are your thoughts on that?
I think we have to be more open. We have to, as uncomfortable as it is, to sometimes say, especially because we all want to be so strong, we don't want to, let our family know, hey, we may need help here. But I would say just letting your family know so they're aware, because sometimes, I think it's more hurtful on a family member to be blindsided and not be able to do anything than to just, hear, that you're going through something and finding out that they can help.
Yeah, that's so true. And another aspect that is, we have to know each other's medical history. And as uncomfortable as that is, we need to tell people what our medical history is. Yeah. we only learned a couple of years ago that colon cancer runs in my family like rampant. Men, women, it's just unbelievable. But for years and years, we just knew that such and such died from cancer. But it wasn't until recent years I started asking my dad and other family members, what kind of cancer was it? And once we started compiling the data, it was like 5 people on his side of the family, from brothers and sisters to cousins. But that prompted my siblings and myself to get tested early because they were getting it in their 50s. So we needed to start getting screenings in our 40s. But oftentimes, because we don't talk about those types of things, we find out about it when we get a diagnosis.
Yeah.
And that is not ultimately, too late sometimes, but it can be too late. Yeah. And you've got to go through these harsh treatments to treat something that could have been prevented had you known about it. So it's really important that we talk to each other about cancer and heart conditions and any other thing that you may have going on that has a genetic component to it, because it is so much better and easier to be proactive than it is to be reactive. So
that's powerful. That's so powerful. It is so much more beneficial for individuals to be proactive. That's really powerful.
Yeah. So medical advocacy is really kind of foreign to a lot of people, though. So what would you recommend for someone? What would you tell an older adult about medical advocacy or their family?
I would say to look at the family members you're closest to, the ones who you speak to on a daily basis, the one who you always call when something is going on, even if it's just the person you call just to update on good news.
Yeah, that's a good point.
Let that person be the person who you call with the good news, but also to say, hey, this is what's going on in my life right now. Mm-hmm. I need to make sure that I have, you aware of this, so in case something happens, you can be there. I know one thing that I noticed is that even with my grandfather, he's one of those guys that's like, doesn't want to go to the hospital, doesn't want to.
I think we all know one of them, like you have to fight them.
Yeah, and so he, with his thing, he worked inside the mills, and he's just that type of guy, and even just getting him to drink water was a thing because he didn't want to. It didn't have flavor. He didn't want it. So I think one of the biggest things that worked for him is him finally saying, okay, I need to drink more water. Mm-hmm. What do you suggest? And the solution for that was the family saying, okay, we'll get you one of the ninja blenders, and he blends the ice and he eats the ice as opposed to drinking water.
Oh, okay. Some alternatives.
So just having the family members there and reaching out and letting people know, because if we didn't know he wasn't drinking water, if we didn't know that he wasn't going to the hospital, we wouldn't have known to say, hey, well, even though you don't want to do this, how about you try this alternative?
That's really good, though. It's like because, and especially when we're dealing with older adults, it's very easy for them to become dehydrated. And dehydration can end up with hospitalization and can have some really dire consequences. But if nobody knows that you don't really drink water, then you can get yourself potentially in some trouble. But something that I would like to add to, when you're dealing with older adults is, we need to start going with our older family members to the physician's office, because I learned with my dad, it does not matter how many times you tell him to ask this or, what did the doctor say? They can tell you part of it. Part of it is age, but part of it is, and I know this is true for myself, that when you're in the office and they're using these words that have 26 letters in them, mm-hmm. You're scared about the diagnosis that you may be, the reason that you're there. You're already feeling anxious about that. So even if you heard and understood what they said, by the time you find the car that you lost in the parking deck, get your keys out and get in, you have forgotten half of what they said.
Very true.
So it's very important for ourselves that when I go to a doctor's office, I'll tell them when they come in, I'm not texting anybody, I'm taking notes. Or I'll write it down. But when it comes to our parents and older adults, if possible, you need to go with them to the doctor so that you can take the notes and you can get all the information and write it down. Because again, once you get lost in the parking deck, you will forget half of what they said. I know we are all very intelligent people, and you'll be like, oh no, I won't forget. But trust me, find your car, fight with traffic, get home, and you won't know what they said. Let me tell you a prime example. So I went to the physician. I have torn cartilage in my hip from all the years of all the knee surgeries. Of course, everything's connected, so it has some other consequences. I went to the doctor I specifically said, I want a non-narcotic pain medicine. We went through the options. He said, yes. I knew when I left there that I was supposed to have been getting Mobic. I went to the pharmacy, picked my prescription up, went home, opened the bag, and it said Tramadol. Tramadol is a narcotic. And I knew that because I researched things. So I called the doctor's office back, and it turns out that the person that sent the prescription in electronically, well, the box for Tramadol and Mobic are right beside each other, and it was an accident. But I knew I was supposed to have Mobic because I had written it down. So guys, when we are going to the doctor, we have to ask questions. We need to take notes. If possible, take someone with you, especially if it's something where you're going to get the results from some testing, because you're nervous, you're anxious, and it could be any a number of things going on. But just to be on the safe side, take someone with you. Take some notes. And if they show me anything, I take pictures of what they showed me, just so that when I get home, I'll understand what they said. Because I'm a prime example. A surgeon will come in after a surgery and talk to you, but you're on medication and under anesthesia. Now go to sleep 2 or 3 more times. And when you wake up, you won't know you actually even saw them, let alone what they said, because I've had it to happen before. And I'm like, I don't know what they said. I know they were in here. So before we end today's show, is there anything else that you would like to add about advocacy?
I would say have those uncomfortable conversations. I think one of the biggest things is, for me, I think from going from a child to a teenager to a young adult and, an adult, I think one of the biggest transitions was, going from a place of accepting, okay, everything is okay, to being in a position of saying, okay, everything's not okay.
Yeah.
We need to have this conversation. We need to discuss it. So I think if you're either the child of someone who is ill, or if you are, the brother, sister, cousin, if you're, someone that is going through something, not just accepting, I'm okay, I'm fine, because they may be protecting your feelings, but not allowing them to elaborate on that, may be something that could potentially cause them harm down the line.
Okay. So with your business, the Rural Umbrella, is that just local to North Carolina or this area, or do you do placements outside of North Carolina?
So it's nationwide at this point. So anything within the United States, we can handle at this point.
Okay, well, definitely tell people how to reach you if they are in a medical field. And first, tell people what kind of placements you do and how to reach you.
Sure. So we do direct placement at any healthcare or technology companies. You can go to theroyalumbrella.com. You can also visit us on LinkedIn at The Royal Umbrella, or on Instagram, The Royal Umbrella _, or just connect with me directly, Demetrius Bethea, and you can find me on Instagram as well as on LinkedIn as well.
Oh, awesome. Well, I really want to thank you for being here tonight. This has been an amazing conversation, and I knew it would be from the moment we met. I was like, yes. I gotta have you on. I think I was like a little excited. I was like, yes, you. I want you. He was like, whoa, lady, I don't know you. But
it was mutual, because I was smiling ear to ear. We just kept talking. It was awesome.
Yeah, but I'm so glad that you were able to join us tonight. So again, we want to thank Authors and Art Studio for being our sponsor and providing the lovely venue for us to do our recordings in. So if you're in the Raleigh area, please come by, have a paint party, visit the relaxation table, or get a signature art piece. Authors and Arts can cover all of your needs. Guys, thank you for watching Joyful Living podcast. Thank you so much. I love you. Bye-bye.